All right, Mary, welcome. I'm very excited to dive into this conversation with you today. I was talking to one of your counterparts in Pennsylvania last week, and you guys are having tremendous amounts of success there. So, just excited to hear a little bit more about that. And this way, we can kind of really align with the mission of spreading the good word of what we're actually doing here at Rebirth and how we are helping people. So, what I'd like to start off with is tell me a little bit about Mary and why is the discussion that we're having today more important than ever?
Yeah. Um, so I've been in healthcare going on 20 years now. And the more I learn, the less I know at times. I think it is constantly evolving and it can be increasingly difficult for people to navigate. Um, my mission in healthcare has and continues to be to help people understand the resources that they have, to keep up to date on those resources and connected to people that can help offer them those resources. Because I've seen the challenges even within my own family. Something happens, it's unexpected, or you're at a loss as to what your options might be. Um, and you don't know quite where to turn. You're going to the doctors and you're coming back and you're like, well, I'm not sure what's next.
Mm,
So being here today, what a great day to have access to this type of format where we can share information. I know through your format and through this podcast, we've been able to help people. People have come to us, they've seen this, and they're like, this is an option. This is a resource that I didn't know. No one talked to me about.
right.
So, us being here to have this conversation, I think brings resources to people's fingertips, um, even more than what we might be doing, face to face out into the community, because sometimes people feel helpless and bring on the Google machine to try to find some help. So, here we are.
And on that, for people who maybe haven't come across this channel before, they have no clue who we are, but maybe someone told them to listen to it. What is it that you actually do and how do you help patients? Like who are you helping and how do you help them?
So, we're helping patients that are looking for solutions. Um, our process and working with Rebirth Advanced Wound Healing is we're going right to the patient wherever they call home. Patients that have been suffering with chronic wounds, that just aren't healing from, the conventional methods that have been made available to them. We partner up with those folks, and a lot of times we're working with home health agencies, and they're going in and they're doing wound care, in conservative measures with what they are able to do, under their licensure. But then we can bring on top of that these amazing grafts that are showing profound results in getting these patients healed. And it's it's good all around because we're giving people their life back. Um, you think of folks that have been suffering from some time, perhaps for 4+ years in some cases of folks that I've talked about, and they are at a loss. They're keeping their wound to a point, but it's just not quite healing. And okay, well, I guess this is what it is, but it doesn't necessarily have to be that. Let's
This
try
is a
something.
really big problem out there. I mean, I know the answer to this, but I mean, how big of a problem actually is this? Like people suffering from wounds that like won't heal.
It is a problem that's getting a lot of visibility right now, at least in our space and talking to folks. I am sure that anybody watching this knows somebody that has a chronic wound. Diabetic foot ulcers. A lot of people are suffering with diabetes, have been for a long time, um, neuropathy. and they're acquiring these wounds and, going through the process. I The amount of people and going into skilled nursing facilities, personal care homes, working with home health agencies, their census of patients with wounds, 1 in 3. 1 in 3 people that are on census suffering with wounds.
That's wild that there's that many folks. And I mean, I've been in home health for the better part of a decade, and I saw this when I was treating initially as a physical therapist. And what I found is that people, and you almost tend to normalize it. Oh yeah, they just have a non-healing wound, or a diabetic foot ulcer. That thing's never going to heal. Or yeah, we're managing it, but yeah, it might be a while before this thing closes. And it's funny how much that just became the norm in the industry, and what we can easily forget sometimes as healthcare practitioners, or just being in the industry, is that these are people too, with lives, with goals, with aspirations, with things that they want to do. And when you start to dive into the stories of this human being and understand who they are, and the things that maybe they're not able to do now because of, maybe not just the wound, but the things related to that as well, like, wow, like how did we just accept the fact that this is normal? How do we just accept the fact that these people are going to live with these wounds that inhibit their ability to do what they want to do for so long? And that's why I think what we're discussing today, and why I'm so passionate about sharing what we do at Rebirth, is because of these transformations, because of the fact that we can wipe clean that slate of the notion that people have to, that they can just accept this and live with it, but there actually is a solution out there.
Mm-hmm.
And it seems like you're really taking that head on in Pennsylvania. So yeah, tell me a little bit more about, I know you've been with us for a couple of months now, and just what have you seen? What has been, I don't know, like your experience so far in working with Rebirth and the things that we do?
Yeah. So, to back up a little bit to talk about these patients and just accepting the new reality of living with a chronic wound and how that affects folks. So you think about somebody that does have that diabetic foot ulcer, and all of a sudden, and with the pain associated with it, and it's getting larger, you got to stay off that foot, right? And all of a sudden now, walking is a challenge. Going to your car and driving is a challenge. Those things being removed from your life, if you feel okay otherwise, but you're dealing with this wound, and it's every morning, every night, every aspect of your life. So yes, giving people the ability to have their life back, and we're not just healing wounds, like you said. We are giving people access to their life again. So that has been remarkable, and people have been overwhelmed with receiving that gift back. You take it for granted when you have it, but when it's gone and you get it back, you don't take it for granted again. That has been amazing. As far as, working out in the community and having these conversations, overwhelmingly, where were you? Where were you a year ago? We need this. We need this help. We had a resident that just couldn't, get out to go to the clinic anymore. Or we had a resident that, it just ultimately sucked the life out of them and they didn't come out of their room anymore. Where were you a year ago? Which makes our conversation even more important to reach more people. I wake up in the mornings and I want to get out there because I want to tell as many people as I can, as quickly as I can, to support them. Because, these are our friends, our neighbors, our colleagues, our family. Like I said, we're all, connected to somebody who's going through this.
Yeah, it's funny. was talking to my mom the other day, and she's always like reposting the things that I share on social media. Like, I'm so proud. This is my son, and like it cracks me up. But I'm happy that she's sharing it. But she told me that my grandmother, I mean, she passed maybe 5 or 6 years ago. But when she and her sisters were taking care of my grandma, and she had some pretty severe dementia, she stayed at home with them, was mobile, but mostly in a wheelchair at that point, just from a safety perspective. But my mom was like, "Man, I wish you guys were around when we were going through this, because man, your grandmother had these massive wounds, and we just couldn't do anything about them." I was like, "Oh, I didn't know that." You start to think about just the prevalence of this. Like, almost everyone's going to know somebody who either suffering from this or knows somebody who knows somebody, and it's just that 1 degree or 2 degrees of separation away. And it's why we're able, or why I'm fueled to have these discussions, because we said, if one person hears about it that they didn't know that it exists. You mentioned in the beginning of this discussion, hey, the ability to share, right, and have really good talks with people that did not know these resources existed, right? How can we get one more person today to know about us? Because maybe they don't need us today, but maybe they can connect us with somebody else who does. And yeah, I think that the longer that we wait, we're doing a disservice to people who could benefit, because there's people suffering, and it's people
Yeah,
that we know and we love.
that's what I always say. I may not be the solution that you need today, um, but maybe tomorrow I am, or maybe you know somebody. And my commitment to the folks that I work with is, if I know there's something that you can benefit from, I'm going to connect you to that. Um, because, like I said, there are resources out there. We are one of those amazing resources that can help support folks that are, really struggling to wrap their arms around what might be going on.
Yeah. So let's make it really clear. Like, paint a picture for me. What type of wounds are you typically healing?
Yeah, so we are looking at basically every type of wound that is considered chronic. So a chronic wound is a wound that the person has had for 28 plus days. Okay. So you have a chronic wound, it is not healing. We are able to take that wound, take a look at it, assess the wound. We need to have notes on it, typically from a home health agency, or if the patient was hospitalized in skilled nursing, they are managing that wound and look that is it healing by 50% or more? Is that wound closing? And if it's not, that is a patient that we can potentially help. So, have we managed wounds that are surgical wounds, diabetic wounds, venous stasis ulcers? Yes. Are some of those wounds what we might think is smaller, but there's tunneling underneath? Absolutely. So if someone's suffering from what they see as a chronic wound, it's not healing for them, I ask them to reach out. I am happy to be able to address that with them and see if it's something that we can help with. If it's affecting their daily life, let's have a conversation.
And how are these grafts, and what our clinicians are doing? How is that different from maybe what home health had done or can do, or how is that even different maybe from like a wound care clinic potentially?
hmm So we have and work with amniotic grafts, and these grafts come from placenta. Placentas are donated by mothers. There are donor hospitals. Um, they'll come and talk to the mother and say, "Are you planning on anything for your placenta. And some people do have plans for their placenta. They may be banking it for future use. I have girlfriends that have had them dehydrated and made in the capsule forms and have ingested them for their own benefit. Some folks do not have plans for that, and they're comfortable with donating their placenta. We say that the baby's the first hero, you know,
Right, because it's
but
technically a donation from the baby, right?
absolutely, absolutely. And it's a beautiful donation that is regenerative, regenerative in life to another person. Those placentas are sent off and they're processed by laboratories and made into these grafts that we place on patients. The graft itself in our process is, once we're working with a patient, we will, go through the insurance process. And once we're able to move forward with them, we'll go out for an initial evaluation on that patient. Let's get a look at it. Let's see what we're working with here. Let's do some, up to date sizing on the wound and have a conversation. And this is what it's going to look like. It's a very hands on process the whole way through, very communicative, and addressing any questions that the patient may have. They likely have not received these types of grafts before.
Yeah. Is
And
there
that's
fear
why,
sometimes from the patients?
what's that?
Is there fear sometimes from the patients?
Um, I think perhaps at times, there may be some like, okay, well, is this really going to work? Is this different? I've been through the ringer on some of these things, but mostly it's excitement. It is the opportunity, like for them, like I feel confident about this. I feel like this is going to be a game changer. Our clinicians are so great in working with the patients. Abby's my practitioner out here where I'm located, and she is the kindest, most knowledgeable gal, and I just really love how she's able to connect with those patients. She brings a softness to what she does, and it's beautiful. But yeah, so sometimes they have questions and we address those, but ultimately, overwhelmingly, it's excitement. These folks are like, I I'm excited to have this opportunity to heal. So once our practitioner goes out and they evaluate the patient, they get to build a little bit of rapport with them, address any questions they have, then we set up a plan for placing the grafts over the course of 12 weeks. We can place up to 10 grafts, one per week, on these patients. And the graft it's this thin um, material, almost like a Listerine strip. And, after they clean, debride the wound, make sure that there's good blood flow to the wound and no infection or anything. And they are able to place the graft, and it almost just immediately adheres into the wound bed. And over the course of those 72 hours in which it's in place, it is imparting all of the healing properties that come from placenta into that wound bed and pulling new tissue up. And we're rebuilding that over the course of those 10 weeks with those grafts. So we go back each week, we check in. If we're coordinating with home health, we're making sure that we're on the same trajectory with the wound. We're giving them updates, any changes to the dressings that we may be recommending for that patient. And we're supporting the patient through education during that time as well, nutritional education, offloading, of that wound so it can heal. If they're a smoker, we're talking to them about smoking cessation, making sure that they're doing everything to promote healing of that wound.
Yeah. Yeah, I think that's so important because, the application of the graft is not super difficult. Our clinicians are fantastic, and I think they do so much beyond the application itself. But I heard one of our clinicians talking about this, saying, "Well, the graft isn't really what's healing the patient. What the graft is doing is creating an optimal state within the wound itself that allows the body to heal itself. And so when we start thinking about all of those growth factors, the stem cells, all the things that are going on that's going to allow the person and the individual and that wound to heal, there are other factors as well. Like if somebody is, like you mentioned, smoking, well, why does smoking make it more difficult for the body to heal? Well, it's things that can reduce blood flow, right? And if there's no blood flow, it becomes very difficult to heal that area. So that's just one example. But things like nutrition, or if you have got a pressure sore and you're unable to offload that pressure sore, well, it's going to be pretty difficult. So I think what our clinicians do a great job of is the complete education, looking at this person as an individual and really coming up with practical strategies and implementation. It's not like, okay, well, we'll eat better. Well, have more protein. Well, how much protein? Like, right? You're talking to people who have been stuck in their ways for, well, maybe 60, 70 years. Mm-hmm. And now we're like, okay, we're going to have to make some changes. Great. I want to help too. How do I help heal myself? I need things that I can actually implement, not just generic platitudes, like move around more.
Yeah.
So I think the specificity of that is what it comes down to, and having that good relationship with your provider and the buy-in to execute on the things that they're recommending. Have you found that as well?
Oh, absolutely. Absolutely. It's not enough just to be, like you said, eat more protein. Okay. Let's talk about how much I need and where I'm getting it from, because I'm not eating, a bag of chicken every day.
So my McDonald's cheeseburger, I got my protein every day.
Exactly. So things like Juven to help support protein intake through beverage. And, how does that work based upon, my weight and what I need? There's a lot that goes into it. And what does offloading look like? Is there supportive equipment that I might be using? Is there a special mattress pad? All of those things, and really going in and taking a look at the environment in conjunction, oftentimes, like I said, with home health. But let's do everything we can over these 10 weeks, and let's make a success here. Let's get this done, because the grafts we provide are such a precious commodity, right? So they've been donated by these babies. Let's make the best use of this, and let's get your wound healed. And, like I said, we have seen profound results with folks.
And I think, we were talking about beyond just laying the graft, because one, step one is, identifying, is this wound graftable? Is it likely to respond, right? Do we have a reasonable expectation that we can heal this thing within, or at least have a significant improvement over the time that our clinicians are in there working with them? And the large majority of the time, the answer is yes. And we do see amazing results with wounds that, again, have been there for 1 year, 2 years, 4 years, as you had mentioned. And so you start to see that. But those wounds were chronic for a reason. They're not healing for a reason. And if they were susceptible to wounds in the past, even if we heal them, which many times we do, well, how high is the likelihood that they may develop another wound if they don't make these other changes that we were talking about with respect to their nutrition, their lifestyle, their mobility, smoking cessation? And so the last thing we want is, great, we've healed up this wound, and then we get a call from them in another 3 months. Well, I've got another spot, my other ankle opened up here and going through the same problem. It's like, okay, great. We're happy to help heal that, but if we can make an impact on the totality of the health of the individual, and not everyone's going to make radical changes, but even if we can have a small impact, I think what this equates to over time is a well care model as opposed to a sick care model, which is largely what our system is geared toward, unfortunately. And we might go down this rabbit hole, and I think it could be kind of fun to discuss. But we know that Medicare is largely moving toward value-based care, value-based payment systems, as well as, okay, how do we make a shift to reduce costs and reward wellness and prevention as opposed to, okay, we've got another pill, another medication, another graft, right? And things that are going to be highly expensive. And so if we're able to have that impact, our clinicians can have that impact in improving the overall health, I think it aligns with what Medicare wants, but also it's just in the best interest of the patient. Because who wants to be constantly dealing with sickness and just treating the symptoms if we have the ability to make small shifts in their behavior and their health that will equate to more quality of life over time. But I know we were having a little discussion about this beforehand, but maybe share your perspective on maybe where you think things are going around the wound care model, Medicare, grafts, and that sort of thing. I'd be curious because I know that there are other healthcare professionals that are going to listen to this that are thinking the same thing. So how do you see things going? Like, what's your take?
Yeah, I think with anything that's coming into healthcare, there's potential for it to be scrutinized, right? I mean, let's do best by the patient. And, how do we get more access to things that are working? And as individuals, we have to advocate for ourselves in that space. We have to speak up and say, hey, I want access to this. So you think about, working with insurance, and I know we've all been through this, and we know somebody, hey, I need such and such test, and my insurance won't cover it. Or, I need an MRI, but I have to do 10 weeks of physical therapy before I can get
Yeah, I
the
got to jump through these
MRI.
hoops before I can see if I have a torn ACL or whatever.
Yeah, I mean, it's a conversation that has been going on for some time. So, how do we advocate for ourselves? How do we move things forward? How do we become part of that, you know, healthcare, not sick care model? How do we move out of like, well, I'm just treating, but all right, well, how do we cure? How do we promote health? And how do we get everyone thinking along those lines? Um, so, in the way of movement with things being scrutinized and maybe my insurance isn't going to cover it, or maybe I don't have access, why not? These grafts are being looked at by CMS, by Medicare right now, regulating bodies, is to, okay, what are they? How are they working? Who's covering payment for them? And how do we manage this moving forward? And honestly, I'm glad that someone's talking about it because it gives us the opportunity to open up insurances and to say, hey, these things are working. We're all speaking up about it. These things are working. Insurance companies pay attention. Get us a network to help your patients. It has been shown that our grafts can minimize cost for folks that have chronic wounds that have been managing them over the course of, 2, 3, 4 years, potentially getting infections and ending up in the hospital and skilled nursing facility. They don't want to be on this roller coaster. And the insurance companies are paying for it. Let's get off the roller coaster, right? Let's move towards something that's working. Let's get some, guide rails around it. And let's trek out of this space of this cyclic, not getting better and just managing.
That's such a good point because, if we follow the money, if we look at the costs involved, right? And someone at Medicare might say, well, the cost of these grafts is really high. Okay, compared to what? I mean, if you look at the dollar value, sure, it might be high. But if say we apply 6 grafts over 6 weeks and heal that patient, compare that to the cost of managing this over 3 years, where they're paying for home health to come in, potential, maybe they're going to the wound care clinic. Their risk of going to the hospital and or rehospitalization is high, and those are extremely expensive visits to the patient and to CMS as well, right? So if we're able to take these factors now and maybe over 3 years, and you look at the cost of that compared to, okay, maybe the 6 weeks, but we healed the patient. Well, I mean,
Let's talk about comorbidities,
yeah,
right? So you think of somebody that, maybe has a surgical wound. They, prior to surgery, they're doing great. They just have a surgical wound that is not healing. Okay. And then, they're frustrated with what's been going on. They maybe can't do the activities that they were doing before. They become depressed. They don't want to get out of bed. Here comes another wound. Perhaps,
more sick care, right?
yes, their diet goes down the tubes because they're depressed and they're just eating, I don't want to go to the grocery store and I got canned goods and bring on the sodium. It's the whole thing that just compounds. And if we can be part of that solution, how beautiful is that? You know, it I want to be part of that solution. I think, you were mentioning earlier about, we have to promote health on ourselves, and we do take personal responsibility for a lot of things. Sometimes things are outside of what we do. I mean, I will share very openly that in my younger days, I definitely dealt with anxiety, as I think a lot of people do in this day and age. And for me, exercising, walking, start running. I mean, that's my medicine for that aspect, and I'm not saying that taking a walk fixes everything, but it can alleviate a lot of things. But sometimes, you need a surgery or something happens, or, you have diabetes and you're doing the best that you can to manage it, but you end up with a foot ulcer. Don't keep going on that decline, you know?
Yeah. I love what you said specifically about taking responsibility, right? Because I think that this is my perception. Maybe it's wrong. I'm willing to be wrong. I'm willing to be wrong. But that for the longest time, when people would go to the doctor and the doctor prescribed something where they said, do this, do that. If the person didn't do it, the doctor would say, well, they didn't follow through on what I said. All right. And it's like, but how many times would you go to spend 5 minutes, 10 minutes in a doctor's office and they say, if they're trying to help you make behavioral changes, things that shift more toward well care and things that are not just treating the symptoms or putting a patch over something or prescribing medication for something, but rather addressing the root cause, that is difficult, right? How do we get people to change their behavior that they have been doing for their entire life? And so much of it comes back to their identity of who they believe they are, all right? This is who I am. This is what I've always done, right? And if you chalk it up to that, our responsibility as providers, I think our clinicians take on that responsibility. I think we take on that responsibility to help people realize that they can change, to help people realize that they can take agency over their own health and actually have a measurable impact on their health outcomes. And when we all buy into that belief, it bleeds into what the patient believes as well. Because if we just tell them what to do, 9 times out of 10, they're not going to do it. They have to understand the rationale why. So I think it starts with education, which is why I love this podcast and talking to people about this. But it's why our team has done so well, is because we have really well-educated people that are passionate about educating our patients and referral sources as well. And so if we take responsibility and say, oh, well, and get rid of that notion that, well, we told them what to do, but they didn't do it. Like, that's BS, right? And we can help those people shift what they believe and ultimately what they do, we stand a much better chance at making a longer term impact for these patients.
I agree. As you're talking, I'm thinking it takes an army, right? Which is why we're doing this and why we're sharing it and why we're being public with our message and our conversation. Working with physicians, a lot of times, hey, you have 15 minutes with this patient, deemed by, the powers that be. How much of a conversation can you have in 15 minutes and be impactful? But folks like us, folks in other sectors of healthcare that are making it their mission to have these conversations and let the patient know, be an advocate for yourself. That's what we're doing. I think it's a beautiful thing. I'm proud to be able to do that with you, TJ.
Yeah. And your work with Rebirth and everything that you're doing right now, why is this so important to you?
Because healing's important. The word itself, you talk about being able to change someone's image of what they're capable of where they can go, of bringing their health back to the forefront. It's important to me. It's important to support, my community. My community is at large where, have people that are connected all over the place to really bring things forward to them, to bolster them up. I think, we have a beautiful life here on this place we call Earth. And to be able to maximize that and help people that are struggling in that space move forward. Ultimately, that's the big picture. Um,
I love it.
Wound care is a big aspect of that. I see how it goes into every space, like we've talked about through this conversation. Um, People's belief in themselves, um, what they're able to do, and being able to be part of that solution is beautiful to me. It's from life, the whole way through. Starting with the baby.
It's very well said, and I love every aspect of that. And I want to make sure that we both have enough time to get back out there into our communities today and continue talking about this. But so to kind of close things out, if you words from you, if there's a patient out there or a family member who stumbles upon this and they have a family member that may be suffering from a chronic wound, or maybe they're a healthcare partner, they work with seniors and like, oh my goodness, I 10 of my residents could use this today. Like, what would you say to them?
Say reach out, message me on LinkedIn, send me a message wherever. My email, mary@rebirthheals.com. Send me an email. I'll give you a call. Let's have a conversation. I'm happy to talk to anybody that we can be supportive to. And like I said, if we're not the solution, I'm going to put you in a direction of someone that I think can help you. That's who we are. We don't leave people. All right, hey, do the best you can. Make sure you eat lots of protein. Have a great day.
So it's have some vitamin D and eat lots of protein, and we'll see you later. No. But no, I think that's a great message, and that's right. If I'll drop Mary's information in the show notes for all of this, mine as well. Either of us will be more than happy to point you in the right direction, at least have conversations. Mary, thank you for blocking off some time this morning to chat with me. It's been a pleasure, and I look forward to hopefully doing this again sometime in the next couple months.
It was awesome. Thank you so much, TJ, and let's get healing.
All right.
All right, bye-bye.
Bye.